Good morning, all. I am Dr. Siddharth Madan. I am currently working as assistant professor in GTB Hospital, which I joined last year only. And I'm giving a few comments on surgical ROP fellowship because ROP I feel is a little neglected topic. And mostly the primary VR fellowships mostly cater to around the adult retina, unless it is a part of a special pediatric VR fellowship is a ongoing topic with that. So slides. Okay, so I have no financial disclosures. We all know that WHO has estimated that there are 15 million preterm births in a year. With the increasing number of ICUs and poor neonatal care, there is increased number of severe ROP cases. And to add to that, stage 5 is a presentation which we mostly come across in our centers because these children have never been screened. So this was a study conducted by RP Center in 2016, where 32.4% of outbound babies were referred to them with ROP and 89% were never screened. 74% were picked up by the parents when they noted leukocoria. Ophthalmologist only referred 25% cases, and pediatricians never referred any child. So there comes the importance of screening these children. International guidelines are different, we are all well aware, but in the Indian scenario the guidelines are different, so we have to screen more number of babies. And unless we come across with a leukocoria at the end, and then we are not left with much. So to apprise everybody of the screening guidelines, the management guidelines are also well formulated. It based on the ETROP cooperative group. So we are all well aware of the management guideline. So how to treat these ROP babies? We have anti-VEGFs, laser, and surgery. Laser is a gold standard treatment. Level 1 evidence exists from the ETB ROP study, and it is a definitive treatment unless the child comes with a loss to follow up, and they may present with a late recurrence. Anti-VEGFs, have given a totally new dimension to ROP management. So all drugs ranging from bevacizumab, ranibizumab, and even few centers are injecting Eylea in these eyes. But anti-VEGFs have a double-edged sword. Not everyone can inject these ROP babies. Babies with the eyes are different. So it's not that the fellows who have never had exposure to anti-VEGF injection. The evidence for anti-VEGF injections exist. Reactivations can happen and complications are well known. There can be endophthalmitis, lens touch. So ideally, such injections should always be administered as we do in our OT setting. And it should be done to eyes separately with separate instruments. Having said that, children may progress. We can come across with stage 4A, but I'm regularly hearing to talks by Dr. Parijat, who I look upon to, and he has also emphasized that early surgery is important in such babies unless we wait for full funnel to close, and then the visual potential is minuscule. So early surgery is a key intervention, and it has various advantages, and that is the outcome we look for in babies who present with eyes like this. So for perspective of surgical ROP fellowship, if we come across, as per this latest classification, if we come across a stage 5 where the optic disc is visible, we will err on the side of early surgery. Unlike in 5B, when the funnel is totally closed, we may not want to operate. And in 5C stages, some centers and some surgeons, it's the choice of the surgeon, but it is usually said that although the results are poor, there's a risk of phthisis bulbi to happen, but you may give a trial of navigable vision to these children by surgery. So various surgical approaches have been mentioned. We have 25 gauge, 27 gauge lens sparing vitrectomy. Clear corneal surgery and a hybrid technique is known. So who is going to operate these babies? So vitreoretinal fellowships are being delivered at various centers across India. However, pediatric VR as a specialty is mostly a part of long-term VR fellowship. Having said this, eyes of a child are different from that of adults, and lifetime of follow-up is indispensable. So I went across and researched the various fellowship programs mentioned on the AIOS portal. I shortlisted the centers which were offering pediatric VR fellowship. However, specifically, ROP fellowship was only mentioned in one or two of the centers. So I had to go back. I saw the contact IDs. I mailed the contact person of these centers. I had a feedback from the fellows and my colleagues, and this is a table which I formed. So to mention how is the ROP training program at RP Center? It is now at present short postings with only 2 or more senior residents who are posted at a rotational basis, and to a maximum of 3 years, which was in the last few years when my colleagues were also part of the ROP screening program. So there is no separate ROP fellowship program at present in RPCs. And the residents who are posted in their short postings, they are given around 100 lasers or to around 30 anti-VEGF injections. And the ones who have an entire tenure of 3 years, they are doing around 300 laser and more than 50 laser, 300 laser and more than 50 anti-VEGFs, I would correct here. And the surgeries are mostly based on observation. Hardly any residents operate, but the ones who are considered surgically confident, so they may be given 2 or 3 surgeries at the end of their tenure. As far as PGI Chandigarh is concerned, a duration of 3 years where the senior residents are posted, they do about 200 eyes in total for lasers and anti-VEGF injections. The surgery offered to such senior residents is almost nil, to about 2 to 3 if the level of the confidence of the operating surgeon is good enough. At the Arvind Eye Care System, as we were hearing to the talk by Dr. Varghese, there is a 12-month surgical pediatric retina fellowship program, which is after the 3 years of post-graduation or once the student has completed 2 years of long-term fellowship in VR. But this is mostly for, as per their website, it mentions pediatric retinal diseases, including retinoblastoma. So I had contacted the Dr. Shah for this input, and he mentioned that mostly adult surgical and surgical pediatric retina cases are given to the residents, and these pediatric retina cases are mostly ROPs. So surgery number of cases given for surgical exposure are dependent on the surgical expertise of the candidate. Looking at the website of Arvind Eye Care Hospital, there I could find that VR fellowships are usually for 2 years, and after that, it is a 1 year fellowship program where uh, the expertise is offered in ROP, mostly in the form of anti-VEGFs and lasers. Having reviewed the LVPI, I got a reference from one of these fellows who underwent 1 month training for ROP. He was given expertise in lasers. However, surgical exposure was nil. At Shankara Eye Foundation, they have a comprehensive VR training program. There is no specific ROP fellowship which is being offered, and this is a part of comprehensive VR training program. The surgical exposure here is also not much. However, the fellows assist the chief operating surgeon. At the Nitralyam in Kolkata, they also offer the comprehensive VR fellowship, which includes pediatric retina, includes lasers and surgery. Surgeries are offered, as I was told. At the MGM Eye Institute, Raipur, they have a 3 month fellowship program. This was mailed to me by the director of MGI Eye Institute. Number of ROP screening sessions in 3 months include 30. Number of babies screened are 200 hands-on. ROP lasers hands-on are given to the extent of 4 to 5. Number of intravitreal injections are mostly observation as the senior faculty are giving. So are the number of surgeries, which are 5 to 7, and they are mostly observation. So number of fellows trained at MGMEI are 7. So that is the expertise offered. IQ hospitals, the duration of surgery is the duration of fellowship is 2 years. They have currently one VR fellow, and that too, this fellow has done one laser independently and assisted around 10 lasers. Center for Sight has short-term medical retina and long-term VR fellowship. However, there is a no specific ROP fellowship. At Lady Harding Medical College, where I spent around 3 years of my senior residency and further 2 years, so I had done almost 50 lasers and more than 30 anti-VEGF injections. I'm currently working at UCMS. The senior residents there are posted with us for 3 years in one team. So since last 1 year when I've joined, we have initiated lasers and anti-VEGFs, and SRs are under training. Surgeries are yet to start, as the equipment is yet to be procured for these small babies. So I would conclude by saying that ROP is an emerging and evolving challenge. There are limited number of centers who are dedicated to ROP screening and management. In the era of anti-VEGFs, the risk for its non-judicious use and over-treatment is likely to be administered by the untrained. So one must not hurry to laser. Early surgery in selective cases may be given for better outcome. So I still feel that ROP fellowship should be a separate program in dedicated centers, and this should be after the candidate or a fellow has gained sufficient experience, say around 2 years of a long-term VR fellowship, and may take ROP as a subspecialty, because the management for these babies is mostly different. Thank you.